Good evening, friends. Thank you for joining Candid Meena every evening to follow what's happening in India and abroad. Thank you for sending me your useful comments and suggestions. If you believe in this channel, do hit the like button, share with friends, and spread the message. Our only mission is to bring you the truth at both sides of the story. From Since you've noticed that since last few weeks, we've been showing this a side of different personalities and their specialization. So today we have Dr. Bhavya with us. Welcome, Dr. Bhavya.
Thank you. Thank you for
Yeah,
having me.
yeah. So Dr. Bhavya is the director of Agni Ayurvedic Village, Panvel, and founder of Agni Arogya, which is a handmade Ayurvedic skin care healthcare products. And she is an Ayurvedic physician. So I've heard a lot about her, the place that she runs, and it is with this, in mind that I brought her onto our channel because I know a lot of you will have questions and related to Ayurveda. So welcome, and really nice of you to join us this evening, Dr. Bhavya.
Thank you for having me on the show.
Yeah.
Thank you for
So
the lovely introduction too.
So, Dr. Bhavya, see, what I've noticed is that ever since COVID started, there has been a resurgence in interest in Ayurveda because people have literally dropped Western medicines to have everything that's natural and mostly Ayurvedic products because they don't have any after effects.
Right.
And in the process, what has happened is people have become healthier. Yes, they would have put on a few pounds because of lack of activity, but definitely, their faces glow and they're, looking really good after what has happened during the COVID. Now, friends, this is the Ayurvedic village that Dr. Bhavya runs. And could you just tell us a little bit about this, Dr. Bhavya, before we go on to more details?
Yeah. So, like you said, I think post the pandemic, people have become more conscious. People have now finally given prevention is better than cure. You know that phrase, we've always heard it all our lives, but people never actually gave it the real importance. And now people have started giving it the value that it actually deserves. So yes, Agni is our uh, baby. So Agni is our Ayurvedic center where we practice traditional Kerala Ayurveda. So the whole idea was to bring Kerala to Mumbai, very close to Mumbai, and we practice traditional Ayurveda, and spreading authentic Ayurveda is our entire goal. So, in the name of Ayurveda, there are a lot of things that actually come in the market, and people advertise Ayurveda in the wrong way. So, the whole idea is to bring real Ayurveda accessible and to everybody.
Yeah. So, Dr. Bhavya, could you just tell us a little bit about your background? See, because one thing for sure is that, see, I believe in the Kerala Ayurvedic way of treatment 100% because for so many years I've been, taking part in it. And I've seen a lot of effects, to my body and the way I behave. See, for example, it brings in a lot of positive energy into us. When we take these even the massages or you're talking about the treatments because it changes you completely and over the years I've seen that, see, the kind of herbs that usually all these sort of villages or you can say wellness resorts have, they grow it on their own sites. So it is just plucked from there and it is sort of crushed and made into that. So it's really commendable that, especially after Prime Minister Modi has given a lot of thrust to the importance of Ayurveda in India. There's a complete resurgence, and as you know, people like Baba Ramdev and all have been very much instrumental in this as well. So I see from the way the pictures that the traditional Kerala house, style has been used for your wellness thing. And could you tell us how you started it and what is your background?
So, at Agni, everything from the stone that is built to the wood that we've used to build it has been brought in from Kerala. Even the workers have done the hand, work and everything on wood.
It's very
Everything is
beautiful.
sculpted. Yeah, so the whole idea was to bring the traditional Kerala feeling here in Bombay.
Yeah.
And moreover, like you said, yes, the entire benefit of growing your own herbs to doing everything from scratch gives a lot of results in every treatment that you do. So it makes a lot of difference in the results that you get and the what we're trying to achieve here is to make Ayurveda accessible, and you don't have to fly down just to Kerala. Or even in Kerala now, there are so many Ayurvedic places you don't know which is here and which is not. So, in the name of Ayurveda, there's a lot of
Yeah, other
um,
side also.
that's happening. So,
Yeah.
clearly, that was our aim.
Yeah.
And
In fact, I would like to credit Maya Jagannatha for introducing you to us,
yes,
because she told me
definitely
that the center is very good. She's experienced it, and we should definitely cover it for our viewers, many of who are not aware of the benefits of Ayurveda.
Yeah, and thank you, Maya ji, for introducing me to you. And yeah, like you said, Agni started with a thought of catering to only illness in the beginning. So 22 years ago, we started this with the aim of treating patients. So it was a small hospital initially. And then we realized that, oh, Ayurveda, people are not only looking for ailments alone. Yes, that is necessary and very, very important. But wellness is also extremely important. And the whole idea is to not fall sick first. And if you fall sick, sorry, am I
Yes,
audible?
I think your voice.
Am I audible now?
Yeah, you're audible, but not loud enough. Can you just put your earphones?
Not loud enough.
Yeah.
Okay.
Can you hear her,
I'm
friends?
sorry. Sorry?
I'm just asking the viewers if they can hear your voice. Can you speak, Dr. Bhavya? Can you just
Yeah,
say
now
a
am
few
I
words?
audible?
Yeah, but it's not loud. But perhaps you can speak a little loudly.
Okay, okay.
Yeah.
So 22 years back, when we gave ailments and illnesses the importance, we realized with each patient, with each uh, person that we met, we realized that how much wellness and preserving health is important first.
Yeah.
So
Yeah.
even in Ayurveda, the whole what do you say? The aim of Ayurveda is swastasya swasthya rakshanam, which means that you preserve the health that has been given to you by God.
Yeah.
And then if you fall ill due to many reasons, could be your lifestyle, could be the food that you eat, it could be other ailments, it could be a virus, it could be anything that causes an ailment inside you. And then, yes, Ayurveda will help you then also, but you have to preserve your health first, most importantly,
And
which
also, you
I
have to
think
be
post the pandemic
quite
people have
patient.
learned better.
Yeah. And you also have to be patient.
Yes, you have to be very, very patient.
Yeah.
When you come for an Ayurvedic therapy, it is very, very different from going in for a surgery. It's not a quick fix. So you
Yeah.
don't go into the operation theater and fix your pancreas, fix your liver, and you come out fine. It's not like that. It
In
has a
fact,
lot of
yeah. In fact, what Maya says is Bhaveji is Ayurveda for chronic illnesses or can be used for acute sudden illnesses like fever, diarrhea. Here, I'll tell you one thing, even before Dr. Bhavya says it. I was in an Ayurvedic hospital in Koilon, which is a very famous, run by Dr. Sabu. And, I had gone with my mother mainly for her leg treatment. And I was surprised. Both of us had fever, on certain days. And doctor told us, don't take any English medicines. I will give you the right medicine. And he gave us some medicine and some, sort of honey-like substance. And he said, just wait 3 days, it will be over. I couldn't believe him, and I was very skeptic. And then after 3 days, I was fine. Then I said, why the hell are we taking all these antibiotic pills? Why can't we be patient and actually take Ayurvedic medicines where you don't need to, fill your body with all these toxic, medicines?
I think that's also lack of awareness around. So it's not as this information is not spread around as much as allopathic medications. Everybody knows, okay, pop a paracetamol, you'll be okay the next day. But nobody knows you can have a Sudarshan Gulika, or you can have a Dhanantaram to, subside your hyperacidity or your fever and diarrhea and things like that. So even for acute cases, we have very good medications for if all these first aid issues like your cold and cough, your fever, your diarrhea, headache, pains, everything which you need immediate relief. Immediate means like 2 or 3 days. It doesn't mean 2 or 3 hours. But yes, you do get the relief if you're patient enough. And plus, you're not harming your body in any way. So it's always a win-win situation there. So
Zoya is asking, I've been hearing a lot about the importance of walking on grass every day for 15 to 30 minutes. I want to ask, does it have to be done at a certain time, or can we do it at night after work?
yes, morning hours is definitely better, like somewhere after 8 o'clock when you get fresh sunlight and good sunlight. Otherwise, post maybe 45 minutes of your dinner time, post your dinner, you can still walk on grass, but avoid like very cold nights. So that again can maybe you can catch a cold or a fever or something. So just be careful during cold nights. That's it.
Yeah. So before we go to the other ailments, the biggest ailment that women face is, is weight. As you grow older, you put on weight, and it's so difficult to actually lose that weight. And Sunita says, see, what are the kind of tips that you can give to a person, and what is a proper Ayurvedic diet that someone can follow? In simple terms, see, because what happens is whenever you look at diets, they give you so many complicated formulas when it should be something simple as red rice and some puriyal, and some sambar. So could you tell us, doctor, what are the tips and what is a good diet?
So Ayurveda diet is very, very different from the other diets that you see on the internet and everything. So Ayurveda diet is actually fun and very creative. You can continue the kind of diet for 4 to 5 years without taking a break. So a diet, I always tell my patients, is not about 4 to 5 days of sustainability. It's about 4 to 5 years minimum. So it's a lifestyle that you adopt and not something that you cheat on. So you have to like simple things, like you said it right. Like stop fearing food. Firstly, love what you eat. Love what you've been eating since you've been a child. That
Yes.
is the food that is right for your genes. So don't go on to these internet diets and crash courses and just select fancy foods. It doesn't make you thin faster. So taking care of your mind is also very, very important while you're following a diet. Especially women get very obsessed with weight issues, and they get very upset that my weight is not coming down. It's been 10 days since I've been starving. मैंने कुछ खाया ही नहीं है. But it doesn't really help. So the whole point is to eat healthy, eat at the right time, eat maybe 5 meals in a day, but you limit the portion there, and you eat good 5 meals in a day. You don't crave for you know junk food. So you can eat your tikkis, your cutlets, all of that. You can have fun snacks. Everything is allowed in Ayurvedic diet.
Yeah.
The
So
only
Zoya
thing
is
is that
asking,
you
yeah, if someone is a non-vegetarian, can she also have? Does Ayurveda help?
absolutely. Ayurveda is not against non-vegetarian food at all. It's a misconception that is spread around. So you can have Ayurvedic medicines. You can do Ayurvedic therapies, but while you're on a detox, which is Panchakarma, yes, you shouldn't be eating something which is very difficult for your body to digest, which
Yeah.
non-veg
I
is.
just wanted to
So that is
interrupt you,
why.
doctor. Is there someone who wants to join us by the name of Rajiv Nair?
Sorry.
Because he's on, I think he's waiting backstage. Is he someone you know, Dr. Rajiv Nair? Do you
Yeah,
know
yeah,
someone?
he's our
Would
chief
you like me to
physician.
add him?
But no,
Yeah,
sorry,
then
no,
it's
I
okay.
don't think he's trying
Yeah,
to
okay,
join.
because he's waiting backstage. So then I'll just remove him. Yeah. Yes. So, yes, going back to your thing. So, I remember very clearly, Dr. Bhavya. See, when I was in this hospital, the doctor used to insist that we have small fish, like sardines, or even a smaller fish which is very famous in Kerala, and he used to say that this helps women in osteoporosis, and it's very
Absolutely.
essential. Yeah.
Absolutely.
So they
Instead
used
of
to, and
having
I used to be surprised that whatever food he gave us was something that we ate at home, which means a
that,
diet of, for example, morning, of course, without oil. So it would be like some dosha and chutney in the morning, and then it would be, a lunch of rice and all these curries, for lunch, and then of course tea. There was only tea with if you wanted a biscuit, but that's it. But dinner again would be something like two chapatis and some curry, and very less fruits. So that was not there at all. So it was a very simple meal, and yet it worked wonders on our body because of the kind of other medicines also that were supplemented during that time.
so, in Ayurveda, we don't promote raw food, uncooked food as much as It depends on the health condition. That's the only time where we personally customize those diets. Otherwise, any cooked food, any well cooked food, your dosha, your idli, your rice, your chapati, which you are used to eating. Yes, you can, change the combination. Instead of eating white rice, you can shift to red rice or brown rice. Instead of eating wheat chapatis, you can shift to multi-millet, chapatis. These are the small swaps that you can do at your home for everybody in general. So swap your white sugar with jaggery or palm jaggery or honey for that matter. So it's very, very healthy, very small decisions that you have to take, but that changes the health of your entire family. So these are things that you can do in every household.
Yeah. So it's also said that, see, you have four different types of body types, like Pata, Pitta, and other types. So in my case, they used to say that, see, don't take brinjal or certain vegetables which I think which absorb water. So that's not for you, that kind of type. So can you tell us about this, a little bit about this?
Yeah, so there are many things that you have to avoid, but again, that depends on your health requirements, your prakriti, and your vikriti. So, more than prakriti is basically our nature, what our body is when we were born, and what it should be. And vikriti is what happens because of the external and internal imbalances.
Yeah.
So, vikriti is what we focus on in Ayurveda when you come as a patient for treatment. So we notice what your vikritis are, and we understand, we assess your entire history, health history, and we decide what you should eat and what you should not. Like you said, even the small fish, it's a small thing that people are unaware of. Instead of having a calcium tablet, you can actually have that. Non-vegetarians can have the fish. Vegetarians have very, very good supplements like ragi, like even your pulses. All of these are very, very good for your bones and your muscles. So you don't actually have to have manufactured supplements. You can get it from your kitchen. So
Yeah.
these small, small things, and gastric irritants like chai, like brinjal, aloo, these things you have to limit in quantity. It
Yeah.
doesn't
Yeah.
mean you
Yeah.
eliminate it
Eliminate.
for life,
Yeah.
but limit them in quantity.
Yeah. Yeah. Srinidhi is asking you, is there a treatment for pylonidal, I don't know if it's right,
Pylonidal sinus in Ayurveda.
sinus in Ayurveda?
Yeah, so pylonidal sinus has to have a surgical intervention there. So surgical intervention and the healing process can be done with Ayurveda. So the surgery is that you remove the mass, and the healing can be done with Ayurveda. So instead of taking these antibiotics and all that for the healing period, we have very good Ayurvedic medications which can be had.
Yeah. Maya is asking, was curious to know whether Jyotish Shastra connected with Ayurveda, since a Vaidya is our village, would ask for our nakshatra Rashi after checking the Nadi.
So this comes from different school of thoughts actually. So Ayurveda is a very creative science. So a lot of people practice Jyotish Shastra, Nadi Pariksha. Nadi Pariksha actually came from Siddha medicine. It did not initiate from Ayurveda initially. So we do more of Darshan, Sparshan, and Prashna Pariksha. That is seeing a patient, whether they have any swelling, whether they have any redness, for example. And sparshan is by palpating them to understand whether there is, any injury there. And prashna is by inquiring what their health requirements are. So that is a more practical and scientific form of, assessing a patient. But yes, there are many people who specialize in Jyotish Shastra, so they do go in, you know.
Yeah. Sunita is saying, ma'am, I've lost more than 12 kilos weight and a 4-inch measurement loss by following intermittent fasting and follow half an hour work daily. Any other suggestions, ma'am? Mine is a 16-hour window. So this is something that a lot of women have got into, which is this intermittent fasting. So could you tell us about what else she can do and about this fasting as well?
So, Ayurveda broadly describes two forms of treatment. One is Langhan, which means fasting. So, fasting is also a therapy for many, many ailments. And it cures a lot of ailments just like that, like your swelling, fever, uh, indigestion, all these things. Our first line of therapy is always fast for a couple of hours. Let the, alasya food, which has not been digested, let it get digested on its own. Your body is the best doctor. Your body knows what to do. So give it that time and patience. Your body will cure it. So yes, intermittent fasting is good, but the thing is that don't blindly follow rules. So you need to know what is good for your body. What happens is there are people who have underlying conditions like maybe gastric irritations, they have digestion issues, and if they fast for long hours, like 16 hours, which is a very, very big gap, they tend to have issues maybe 5 years down the line. So you need to know what it can do to you 5 or 10 years down the line. That is why you have to consult your doctor personally before following any of these diets.
Yeah. Zoya says, my mom has been having a very high sugar for some time. Does your center have a retreat kind of thing where anyone can register and come and stay and get healed? Do you all do meditation, pranayam too?
Yeah. So for diabetes, what happens is type 2 diabetes, your body has the ability to produce insulin, but your insulin is not being utilized maximum. So when you do Panchakarma, you do an internal cleansing of gut cleansing and colon cleansing both. And what happens is that your insulin absorption becomes better. So when you do an entire panchakarma, your body is able to utilize its own. We are not supplying insulin from outside, but your body is able to utilize for maximum, benefit. And yes, some dietary changes will be there, but normal ghar ka khana, roti, dal, sabzi, chawal, everything is allowed. You don't have to fear food if you're diabetic. But yes, you have to love your food, love your body, and cure yourself. So
Gia is asking you raw form. Okay, so back to what Zoya said. So can she put her mother in that in your resort?
yes, absolutely. And one more part of the question was that whether there is pranayama, meditation, and
Yeah,
all that
yeah,
also. Yes, in diabetes, you have to take care of your stress levels very much. So, everything, your breathing pattern to your thought processes, your stress levels, everything has to be taken care of. So, it's a holistic approach.
yeah,
So, your nutrition to your Ayurvedic therapies, medications, and yoga is involved.
yeah. Now Gia is asking you raw form of veggies are higher in pranic energy. Then why Ayurveda does not allow raw food?
Right. So raw food, see, we're not against raw food. The thing is, it's a little difficult for your body to absorb nutrition. So when you either steam it, boil it a little bit, or maybe just toss it in some traditional oil for a bit, it cooks and it breaks the bondages of the raw vegetables, and your body is able to absorb the nutrition faster. Otherwise, the fiber content is so high that it just, for bulk stools formation, it helps and you clear it out of your system. You don't really get the nutrition out of it. So that is why we advise you to either steam it or just cook it a little bit so that you get the required amount of nutrition from your vegetables.
Nanda says, want to know correct time for eating fruits. There are many views, but which one is the right way to eat fruits?
To eat fruits, eat local, eat your seasonal fruits, and always eat your fruits. Don't drink them because
Yeah,
juices
but
will not
timing.
give you.
Yeah,
Sorry?
the timing.
Timing, yeah.
Time.
Eat your fruits like probably 1 hour after your meal or 1 hour before your meal, never with your cooked meal.
Yeah,
So that is very important, and
yeah,
avoid night time.
yes. Ayurveda doesn't promote if the timings where you skip breakfast. I didn't get you,
Yes.
Vishali. If is chakra also connected with Ayurveda? Definitely, it
Chakra is
is.
a yoga sign.
Yeah.
That is an insight.
Some dietitians tell us if a cause of metabolic disorder, is it true?
Sorry.
She's asking, some dietitians tell if cause metabolic disorder, is it true? I still did not get her point. Perhaps she can elaborate on
Yeah,
that.
I think the question is
Yeah. So, Priya, you've asked a question. Can you just repeat it? So, meanwhile, I'll ask Dr. Bhavya something else. Dr. Bhavya, friend, our viewers are telling us that you're a very young lady. So, how many years of experience do you have in this field? And how
so
did you
I've been
get into this
practicing
field?
for 7 years now. Sorry.
Viewers are saying that you look like a very young girl. So,
Yeah, I've
how
been
many years of
practicing for seven
experience?
years now.
So that's Ayurveda for you, anyway. So, how many years of experience have you in this field, and how did you get attracted to Ayurveda?
So we are from Kerala basically. So in Kerala, it's part of your upbringing. It's part of
Yeah,
your
which part?
routine.
Which part of Kerala?
I'm from Thrissur.
Yes.
So, be it my grandmother, be it my parents, like if they fall ill, always their first line of treatment is going to an Ayurvedic doctor. And Agni has been there for 22 years now. So I've grown up in Agni. So it's always been a part of my learning and my interest. So I've always been around Ayurvedic doctors and patients and all of that. So I didn't know life any other way, I guess.
So, do you also own the property, or you just working there?
No, my parents own the property.
Yeah.
Now I
Okay.
run the place.
Yeah. Now, Mohana is asking you: is it okay for my husband to have salads as he is having severe allergy problems?
It depends on what allergy he has. So that's also a very important part. And salads, yes, depending on what allergy he has, he can avoid certain things. Otherwise, cooked salads are always better.
Yeah. Nina is asking: is walking the best exercise for any problem?
Depends on the problem again. So walking is definitely very, very helpful and the best exercise. And if you're walking outdoors, it helps you with getting good oxygen. It helps you with, keeping your mind fresh. It gives you a lot of energy. And walking is the simplest and the fastest exercise that you can adopt.
Yeah. Priya is asking: I'm 50 plus, and when I eat something, I feel pitta in my throat, and I don't have tonsils. Please help.
Okay. So that means that there is an issue in your core digestion. So that is why whatever you eat, it doesn't go in the right direction and it comes in the pratilom pratil, which is the upward direction, which it should not come. So either you're not eating right, you're not eating at the right time, or you're not eating the right combination, which becomes a chronic issue. And then after a couple of years, then you start showing these signs. So this is also to do a lot with self abuse, like maybe you're not feeding yourself the right food, you're not feeding yourself at the right time. So you need to assess what you're doing in a day also. So your dinacharya is very, very important in Ayurveda. Dinacharya is a very, very big aspect in Ayurveda. Like how you conduct yourself through the day, it plays a big role in how your health will be in the future. So I think educating everybody about how you should be in a day is very, very important.
Ruhi is asking: is intermittent fasting the cause of metabolic disorders?
In many people, yes. Like I said, if you don't understand what your body requires individually, no two-person will have the same response to one form of diet. So basically, you have to understand what your body requires and how much time your body can sustain fasting without losing energy, without having any metabolic dysfunction. So that is why you should take an advice of a doctor and then go in for the window is either 16, 8 or 12, 12. So there is no hard and fast rule. So you have to make sure that you're not harming your body in the, need to save yourself from weight.
Sunitha is asking, I have my breakfast daily, only a little late. That's it. Till date, I don't have a single bout of acidity. I started this last year, rainy season. Also, I became very active and energetic too. So it seems to be working very well with Sunitha.
Right. So if it
So,
works well for you now, that also doesn't mean that it can work for you later. So it can work for a good period of time, but then later, when obviously age progresses and your stress level progresses, it can hamper you in many ways. It can cause digestion issues, it can cause acidity and all of that. So you have to be very wise about your decisions now.
yeah. So, we are saying, is ashwagandha something anybody can take for stress? Does it nature you to put, does it do you put on weight because of that?
Ashwagandha is a nourishing herb. So yes, for weight gain, like when you want to gain weight, we advise this herb, but that doesn't directly, cause any weight gain. Ashwagandha works in stress, but ashwagandha alone not necessarily. So depending on your stress levels, depending on your symptoms, whether your sleep is hampered, whether your any other physical ailments that you have, but ashwagandha is in general a very energizing herb. So
Yeah. Varun is asking you, ma'am, my mum feels uneasy during sleep, due to which she always feels tired. She is also taking medicine, though, but still panics and doesn't sleep well. May you please help her?
right. So this is a common complaint, like you said, anxiety, panic, depression. These are not only in women, in men also is a
So
very
here,
common complaint.
yeah, here, Dr.
And
Bhavya, can I also tell you my remedy, and you can tell me whether I'm right or wrong? Okay. Now this is Varun. You also listen. Okay. This is also said by another doctor. What you do is at night, you take a banana, okay, and you cut it into pieces, and don't throw the skin. With the skin, you boil it in say a glass of water, and then reduce it to half a glass. Okay, and then you put some what you call cardamom, ground cardamom, and also this what you call cinnamon powder, a little bit of cinnamon powder. Okay, and then you stir it, and you just before you go to sleep, you had that. And I found that it miraculously puts you to sleep for hours. And apparently, this magnesium and all is very good for your system. Now, doctor, you can tell us what is
yeah,
your.
so that's a very good remedy. It's a very grounding remedy actually. It helps you calm down. So Ayurveda doesn't recommend anything which is actually a sleeping pill. So
Which
Ayurveda
is
has these
which is
remedies which are sorry.
you wouldn't recommend something which is you just said something.
Sorry.
Yeah, you just said
Sorry.
I wouldn't recommend.
We don't recommend sleeping pills. So we
Ah,
don't have
exactly.
sleeping pills
Yeah,
in
yeah, yeah,
Ayurveda.
exactly. Yeah,
So everything is like grounding, calming. These are all nervine tonics. So the
yeah.
enzymes that are there in banana, cinnamon, and cardamom that you're adding are all very calming in nature. So it calms your system down so that you're able to sleep
Yes.
deep. So that's the
So
whole idea
actually,
in
you
Ayurveda.
know what, doctor? I recommended this to my mother also, who's above 87, and she also has a very peaceful sleep because of this. So what we do is, in case you can't heat it at that time, get a small flask, and fill it with this, and put it near your bedside. So it's very
Yeah,
convenient for you. Before you sleep, have it. So that I think should answer your question, Varun. Uh, and Sunita continues. She says, but on weekends, I'm not very strict about eating window. I go for 12, 13, or 14-hour window, not very strict of my regular. Fine. Very nice of you to tell us. Now, Vishali says, CBD oil is promoted a lot in the West. Your thoughts, doctor?
CBD oil has now come up very, famously
Could
in
you
the
give us a
West.
full definition?
CBD is actually cannabis oil, which you extract from cannabis. So there are a lot of studies on it, and yes, it is a herbal medication if used in the right way, if extracted from the right type, and used in the right dose. So yes, there's a lot of misuse. Like I've personally had patients who've had CBD oil for years together, and they've had muscular dystrophy, nervous degeneration, many complications because doctors have not guided them well. So I wouldn't recommend it without proper research backing it up.
So Gia says, I've tried it too and had a nice deep sleep after a long time. Gradually, my sleep pattern repaired. So that's good to hear.
That's nice.
Zoya says, what does Ayurveda recommend for someone on dialysis 2 times a week? A very young person I know has been on it for a few years.
So Ayurveda has certain medications which are good to cleanse, any kind of water retention in your body. And when your kidneys are not able to filter it on its own, that is why you go in for dialysis. So you can't completely reverse a situation where it is very chronic. So chronic kidney diseases, you need to know where your creatinine levels are, where your other parameters are, and you can taper down the frequency of dialysis that you have to do. But not completely reverse it, because the thing is people approach Ayurveda at a very later stage, so then it's too late for us also to address it.
So Renu, who is also from your part, Trishur says, Bhavya Kutti Sugamano.
So good
So
morning.
Meera
Thank you.
says, highly recommended Ayurvedic treatment include massages for rheumatoid arthritis as well as osteoarthritis.
Right. Absolutely. So
Yes.
this is
Yeah.
something that not many people know. Rheumatoid
Yeah.
arthritis and osteoarthritis are treated in very different ways. In
Yeah.
rheumatoid arthritis, we primarily focus on dry therapies. Without oil, we use medicated powder potleys, medicated decoction dharas, which bring down the inflammation because it's an autoimmune reaction. So your body starts fighting with itself. So you need to bring down the inflammation.
Doctor, why is it said that Ayurveda acts best during monsoon periods?
Yeah, so Ayurveda works during monsoon best because that is the time where there is, see, that's for rejuvenation purpose. When you're looking in for illness, yes, whenever you have the illness, you have to address it. But why monsoon, Karkadaga Masam is known for the best time for treatment is because there's a lot of tendency to catch infections.
Yeah.
There's a transition from summer to your winter, so monsoon is the time when your immunity is compromised the most. So when you do Ayurvedic therapies, your body is more receptive to it. Your body is taken care of for the next 365 days. So that is why Karkadaga Masam is the best time for you to your because of the climate, your body is so adaptive to these therapies because it's not too cold, it's not too hot, and
And they
you
also
save
say
yourself
that
from
your pores are open at that time.
pores are open, exactly. So your body accepts and absorbs everything that you give it, be it the medicines, the oil that we use, the potleys that we do. Everything is more receptive, and you get 100% of the benefit.
Also, what I've noticed is that whenever you go in for rejuvenation treatments or for slimming treatments or any other kind of massage, after you do a period of massage, they always tell you that you should not exert your body. You don't get into activity immediately. You should take a lot of rest. What is the reason for this?
So, for example, if you're doing a 2 week therapy, there's a 2 week period window that we call a Nellarika period, which means that you have to rest during that entire period. So 2 weeks you are actually, you think you're not doing anything, but your body is passively getting workout done. So even a simple massage is equivalent to 1 hour of proper workout. So it is being passively, your circulation is being corrected, your muscles are being, you feel sore within a few days actually.
Relax.
It feels like going to the gym after a long time.
Yes,
So
yes.
it's equivalent to a workout. So why your body, it's like servicing your body, your nuts and bolts are all loosened, oiled properly, greased properly, and then fixed back. And then when you go back home, you can't start running again. You can't just, go back into your normal routine or
Slowly.
just like that. So you have
Yeah.
to give yourself time to slowly and steadily go into
Get
your
back to.
routine. So
Yeah.
especially why we tell it in cities is because we have a very fast paced life in Bombay
Yeah,
or in
absolutely.
any other city. So you have to be very careful after you come back from an Ayurvedic treatment. So you can't directly go and sit in your office under the AC for 12 hours. That will give you a complete drastic opposite reaction, and you might fall ill immediately. That is why you need to rejuvenate yourself at home, eat the right food. Your digestive capacity becomes like a baby's gut because you've cleansed it completely.
Yeah,
So you need to slowly and steadily develop the capacity to digest the kind of food that you were eating before. So
absolutely.
everything plays a big role.
Yeah, absolutely. Karthik is asking, is there any good Ayurvedic option to burn stubborn fat?
Yes, like we discussed, a good Ayurvedic diet is extremely helpful. There are good supplements also, which are very helpful. It cuts down the stubborn fat. It helps to cleanse your liver, which is the site of metabolism. So once your liver is active and not sluggish, that is when your fat breakdown will become faster.
So Vishali is saying, do you have any stories about cancer treatments?
The cancer treatments, yes. At Agni, we've managed a lot of cases that come with cancer. So it depends on what cancer you have, which organ is affected, what stage you're at, and what your symptoms are. Many a times, like you're at a very advanced stage of cancer, but your body is strong enough to sustain those symptoms. Your body responds very well, and there's an opposite case also where your body is at a very initial primary stage of cancer, but your body is so weak because of your lifestyle or because of your other underlying conditions that your body is not even able to digest a small meal. So, in cancer, what you need to do is you need to take care of your immunity, you need to take care of your digestion, your sleep. It's a holistic approach in cancer patients that we do. From yoga to your breathing pattern to what you eat, how you conduct yourself through the day, everything plays a huge role. And again, your lymph drainage is very important. So the massages help you to drain your lymphatic system. It helps you to improve your blood circulation, your nervous supply, and your body becomes more energized and is able to fight it much better.
Yeah. In fact, just going back to what Karthik said about getting rid of stubborn fat. In fact, Karthik, see, there are so many Ayurvedic pointers. For example, they insist that you drink warm water, throughout the day. Do not drink cold water. Second thing is that, see, they have, powder massage, which is used to, as you say, the stubborn fat. If you want
The
it to go, there
subcutaneous
is a
fat
treatment.
is
Yes. Yeah. So in that treatment, it would go on for either 7 days or 14 days, and at that time, it's one of the best treatments your body can undergo because the fat that you had for so many years, which you've accumulated over the years, does disappear. And also
yeah,
with that, they combine, I think, Ayurvedic massage, oil massage, and also steam. Steam is also a very
and
important
it's a
part
more
of it.
sustainable way of losing weight. You lose weight and you don't gain it back double when you go back home.
Yeah,
So
yeah,
you
yes,
sustain that weight loss that
yeah,
happens in an
yeah,
Ayurvedic treatment.
yes, yeah. And you feel so healthy. After when you leave the wellness center, you feel so good, and somehow you feel that the doctors and the people who massage you are really like angels, people who really care for you. And I've always left any center wherever I've gone. I've always left with a prayer, to look after these wonderful people, who devote their time and energy to make you well. See, because see, this is not like any other hospital where people come and just treat you and nurses come and change you and do that. No, here there is a bond. Even before, when they do the massage, they start with a prayer, and that is in the chakra points. Sorry, doctor, I'm just telling them a little bit from my whatever knowledge I have, because I've been having this for ages. I don't know how long I've been going. Whenever I get free time, I go for treatments because uh, that is the best way for you to live a life without going for operations or surgeries or unwanted things. These are all not needed if you can follow the natural path. So again, see, what they do is they do a prayer before they do the massage. They treat your body like a temple, you know,
Mm.
and they are very careful. Even when they turn you, they are very careful. Do you have any pain? So all these things are looked into when they do these treatments. I remember my mother was, see, mother's pretty old, so 86 years old, but the way they handled her, she had severe back pain. The way they used to handle her, I used to really thank these people, because so much of passion in what they do. So, doctor, let me just take a few more questions, from so many questions just coming one after the other. Meenaji is like a doctor. We should have some. It's just that I love Ayurveda, and that's why I was so happy to get in Dr. Bhavya, to answer your questions. Right, Meena? I always feel the masseurs. I feel heaven must be feeling like this after a massage, like Mukhi Pirche. That's Samira, who is also very fond of Ayurvedic, treatments. So Karthik says, I want to go for Ayurvedic detox. Any suggestion, Dr. Bhavya, for the type of detox?
Yeah, so the type of detox, the Panchakarma is basically 5 types of detoxification, but not every type is required for everybody. So depending on your health requirements, like whether you have a digestion issue, whether you have a Vata disorder, whether a Pitta disorder or a Kapha disorder, we decide on what we have to do for you. And a minimum of 7 to 10 days or 14 days is required to do a good, sustainable Panchakarma for you, which will give you long-lasting results and which will take care of your root cause issue. So we analyze what your root cause is for the ailment, and not just symptomatically, like, if you have a pain here, we don't just rub oil there and we leave you. So we understand why that pain is coming there and what has caused it, and then we treat that issue. So I just want to share one quick
Absolutely.
example. So people who come with back pains or knee pains, we do a panchakarma called Vasti. Vasti is enemas, medicated enemas. So people who don't know about Ayurveda are always wondering, why is Vasti or enemas given for a pain or a back pain or a knee pain? But pain in Ayurveda is related to Vata, and
Yeah.
Vata. So Vasti is called Ardha Chikitsa of Vata. So you do 1 or 2 sessions of Vasti and your ailment is like half solved already. So that is why Vat disorders are first treated with Vasti. So oil enemas and decoction enemas are done. And I mean, I don't know how to emphasize on the miracle of what Vasti can do to you with arthritis and other disorders. It just,
So
uh,
you mean to
you know,
say,
the
it is an enema with the medicines in it?
Yes, yes. So enemas with the medicine combination is the game changer here. So the kind of combinations that we curate is different from patient to patient, depending on your
But
health
then,
requirements.
but then, see, is a normal enema with warm water equally effective?
No. So in a water enema, it cleanses your colon. It doesn't really treat the issue. So why enemas are given? I'll also explain, if you give me a couple
Yeah,
of
please,
seconds, why
please.
enemas are given in Ayurveda. So we can't give you 1 liter of Kashayam to drink at a go.
Yeah.
Okay. So your body and mind both will not accept 1 liter of Kashayam inside you. You will vomit it out or throw up, and your gut will not absorb even a single drop of it. Why we give these medications through colon is because your colon has small hair-like structures that surround it, which has more absorptive capacity than your stomach. That is why these medications are given through your colon, and your body absorbs the essence of it. Body absorbs maximum amount of nutrition from the herbs, and the rest of it comes out. So it's not a scary process.
Mm.
So the rest of the enema liquid which is given, which is not required for your body, is thrown out,
Yeah.
and the essential medicines are absorbed in it. So you get you can't because you can't drink 1 liter of kashayam. We give you through an enema, and you get maximum benefits of it. So your degeneration of your bones, your nervous degeneration, all of that is taken care of with these herbal combinations, and they're very, very effective.
Karthik says, I'm weighing 86 kilos now. I was 75 before COVID. I'm a fitness freak, hence more concerned about it. We were discussing this earlier also, because of COVID, people became, sedentary, and their lifestyles affected their weights as well. So that's why he asked the question, which you have already answered. Now let's go to some other questions. Karthik, lean and mean is a term that they say just go together. Please, is there any help for lung fibrosis?
Lung fibrosis is a case where your lung tissues are slowly dying and not getting the right elasticity. So what happens there is you need to save and arrest the progression of the condition. So whatever damage has been happened in the existing tissues, you can't reverse the situation, but you need to make sure that you arrest the progression then and there itself, and it doesn't get worse, and then nourish the existing cells of your lungs. So that is where we have excellent respiratory immunity medications in Ayurveda, which solves a lot of these issues. So post COVID, there are a lot of people who are hospitalized for months together and have had these kind of ailments and have come and achieved a lot of benefit from Ayurveda.
Ved Godbole says, Dr. Bhavya, please help me with Arjun Sal and Anand Mool benefits and other things.
So Arjun Sal is it's a magical drug for heart ailments. So for
Heart,
any kind of
for,
heart ailment, sorry,
for any kind of heart ailments?
heart ailment,
Heart ailments.
heart ailments, yes.
Yeah, yeah,
So your blood near me.
yeah. I can hear you. Yeah,
Yeah.
yes, very much.
So,
Yeah.
in any kind of blood pressure issues, both hyper and hypo tension, it is used. It is very good for your sleep disorders. It is very important for heart patients who have like blockages. It is good to cut down the cholesterol that is, hampering the circulation towards through
Here,
your
can I
blood
ask you a
vessels.
question, doctor? So, suppose you're a normal person. Can you use this as a precautionary measure as well?
Yes, you can. So, either you have an underlying condition somewhere, you can address it then, or even like post 50. So, Arjun is even infused in water and drank. Like you
Okay,
can put
okay.
a small
Yeah,
piece of Arjun sal in your water overnight, and you
yeah.
can consume that the next morning. That is also
Okay.
very good.
It's good to note. Yeah. And Anant Mool?
Anatumol is very good for Vata disorders.
Yeah.
So pains, aches, muscular spasms, all of that. Anatumol is very good. It can be used to make oils. It can be used to infuse in like your oil and apply it all over your body. It can be used as a lepa wherever you have aches and pains. So you can just mix it in a little bit of warm water, make a lap and apply it. So that absorbs the inflammations and pains.
Julie is asking you, suffering from abuse and epilepsy, so can't get out of a relationship, so need to be stronger. Now, perhaps she means abuse in a relationship and epilepsy as a result of that.
So here, your root cause is the mental depression or the anxious behavior that you've adopted to get out of this relationship that is causing other physical ailments like epilepsy, which is a very serious condition, and you need to address it as soon as possible. You need to get help because you can't resolve it on your own right now.
Zoya is asking, does Ayurveda recommend oil pulling? I've heard a lot about the benefits of overall health doing this. Does this treat illnesses also? Oil pulling.
Yeah, oil pulling is something like you should adopt as a dinacharya. Like I explained before, dinacharya is something that you do on a regular basis. Like people only brush their teeth and rush to work, and uh,
So,
brushing and
doctor,
bathing is the
I
only.
do this every night. I do this oil pulling every night, and it has helped me immensely for my gums. Do I need to do this in the morning as well?
So you can do it in the morning and night, both, or any one time, whichever is convenient, because it requires some
So
time. Like it can
let us just explain it to the common man. What is oil pulling?
Oil pulling is basically depending on what your requirements are. Either you can use simple oils which you find at home, a coconut oil or til oil or sesame oil. That you can use on a regular basis. just 2 spoons of it can be swished in your mouth for like a good 5 and 10 minutes. It's not something that you do for a couple of seconds. You should do it for a good 5 and 10 minutes. And like you said, when you do it in the night, it's also a self-care routine which helps you to unwind your day. It's some time that you give for yourself before you go to sleep. So it's a good session with yourself, and this helps to protect your oral cavity, your teeth, your gums. Yes, and plus the bad bacteria which causes indigestion, which is a result of indigestion and causes indigestion both. So both can be tackled with oil pulling. So when you do oil pulling, it's not the gums and the teeth that you're protecting, it's also your inner GIT. So your digestion starts from your mouth. So you need to protect the health of your oral cavity first, than your internal health. So when you do oil pulling on a regular basis, the good bacteria stays and the bad bacteria goes away. So you don't have any other side effects of indigestion like bad breath and belching and erosion, all of
Yeah.
these things.
So I think we have one viewer who wants to join us. Welcome, Rohini. You wanted to join us. Actually, it's our last 5 minutes. So whatever you want to ask doctor, please ask fast.
Right.
No, no, no. ഒന്നുമില്ല. Hi, doctor.
Hi.
You wanted to ask us something?
ഒന്നുമില്ല. No questions. No, I just came to see the interview. No questions.
Okay, fine. So then we'll have to remove you. So because we're just in
Yeah.
the last minute of our chat. So please excuse me. Yeah. So back to you, doctor. So everybody is really thrilled to hear your speaking about the different ailments and the the sort of treatments. Neelam is asking, Namaste Minaji and doctor, please give a remedy for sweet replacement for diabetes like jaggery for tea or anything but sugar free, which hits more than sugar.
Jaggery is the best remedy, and palm jaggery. A little, it's a different version of jaggery. I think South Indians are a little more, you know, known to this side of jaggery. It has a
Jaggery, yeah.
different taste. Palm jaggery is more nutritious than the regular jaggery as well. And honey is a good replacement. I don't know why people are scared of honey also. Honey, if you get it from the right source, is extremely uh, safe replacement to white sugar.
Okay. Sanjeev, yes, I also need to lose a lot of weight. So thank you for your advice. Ved, doctor, even medicine, Kapila,
Sorry.
medicine Kapila, it's Ved is asking about the medicine called Kapila.
Yeah, so Kapila is basically used for neurodegenerative disorders.
Okay.
So in Parkinson's, in stroke patients, and all that, we use this. So it is a very good replacement to, like, I don't want to say a direct replacement to allopathic medications, but it's a very, very good. So any kind of a lack in signal between your neurons. So that is where this is used.
Zoya is saying, thank you, Minaji and Dr. Bhavya, for the immense knowledge both your smiling faces made the session even more wonderful. And Neelam Mohanty also says, thank you so much, Dr. Bhavya. So, Dr. Bhavya, if you can think seriously of coming more often on our channel, because a lot of the people are interested. So, whenever, if this time suits you, you can tell me like whenever you're free, you can always come because I think by talking to us and our viewers, you're spreading immense knowledge about Ayurveda and why, as Indians, we need not go for Western therapy or Western medicines. And this I can vouch for you. See, now Dr. Bhavya will say this because she's an Ayurvedic doctor, you think, okay? But I'm sitting objectively, and I can tell you that, see, through all my years, see, ever since, after my 30s, I've been constantly taking only these sort of medicines and treatments. And I can tell you that, I feel so fit because, there is no after effect, even if I take some kashaya. So here's one last question before you go, doctor. See, there is a difference between kashaya and taking capsules. So medicines as in capsules. So could you tell us that? Because many people
Hmm.
don't like to take
Thank
the
you for giving me this
bitter kashaya.
opportunity.
Yeah,
Thank you for giving me this opportunity to talk about this, because this is a daily struggle for us as Ayurvedic doctors. Because, for example, a 20 ml Kashayam, we need to feed you probably 6 or 7 capsules to get at least half the benefit of consuming a Kashayam. So, um, in our daily practice, that is a struggle to convince patients to consume kashayam and, to understand the benefit of it. But yes, like you said, post the pandemic, people have been taking it seriously, and people don't now, opt for shortcuts compared to what I've seen before. So yes,
yeah,
people are more adaptive to traditional Ayurveda again.
yeah,
But yeah, I can't really blame them, because it is a little more convenient now, as Ayurveda has also progressed in, finding out tablet forms and churnams of each kashayam. So you get sachets of these, dehydrated kashayams, which you can just mix in water, because it's easier for travel purpose.
mm,
So you can't always carry a bottle of kashayam wherever you go. So I understand the struggles of a daily this thing, but yes, consuming a kashayam and consuming a capsule is very different effect
yeah.
wise.
And Maya's last question to you is Netradhara good for sinus?
Netradhara is not essentially for sinus, and Netradhara depends on the kashayam that is made for Netradhara. So for sinus issues, we have to do a panchakarma called Nasyam, which is
Yeah.
instilling medicated oils or medicated juices through your nasal cavity, and that clears out your sinuses.
Yeah,
So Nasyam is always a better option for sinus issues.
yeah. Thank you so much. I think with this last question, we'll end this session. And please do think about it, Dr. Bhavya, because we would love to have you more, on our program, because a lot of the people get educated, and not only that, a lot of the people who would like to visit your wellness center can also, come. And what I'll do is, friends, I'll put the details in my contents below, so that in case you want to contact doctor and her center, please do that as well. Thank you so much,
Thank
Dr.
you so
Bhavya.
much for this opportunity. And the questions were lovely. And I realized that there are so many, things that we can actually, so much information that we can spread, so that people understand that when to opt for Ayurveda.
Yeah,
I think that lack of information around is causing this confusion.
yeah.
So
Just
thank
one
you for
question,
giving
which
me this
is, which
opportunity.
has been, sort of, I'm curious about, is that there was a point when when our Prime Minister spoke about a certain mushroom, which he eats and he orders
Yeah,
specially,
yeah.
which gives him a lot of energy. Could you tell us which mushrooms are these?
I'm not aware exactly, but he does say that that mushroom is grown in India and he
Yeah,
consumes them. So mushroom is basically a fungi,
yeah.
and which gives you very good bacteria for your gut, and hence
Hmm.
it improves your digestion. It gives you good energy levels. It gives you good skin, and so it has multiple benefits.
Yeah, because most of the time we talk about button mushrooms, or
Yeah,
that kind which we get from all the stores. So
right.
thank you for that, Dr. Bhavya, and we will keep in touch and discuss how we can work more with our viewers, because you've been seeing the number of questions is just been going on and on, because people are really worried about the kind of sicknesses they have, and they don't want to take English medicines which have after effects. A lot of the people are put onto very hard medicine, which changes everything. So thank you for that, and good night.
Thank you. Thank
Jai
you so
Hind.
much.